Dear ladies and gentlemen, thank you very much for the kind invitation to Oxford, and I'm going to present today our 3 months results with Smile Pro. So this is a new VisuMax 800. We started nearly 10 years ago with a VisuMax 500, and in 2022 we were so happy to have one of the first 5 in the world VisuMax 800 lasers. It has two arms, as you can see. One arm is for laser surgery, for Smile Pro, flap creation, ICRS implantation, and the circle procedure. And the other arm is for the microscope. Here you can see the laser arm coming down, and the rest of the movement you can steer with this joystick. And after you finish surgery, the microscope arm will come down to the patient and you can continue surgery. So what are the improvements if you compare the VisuMax 500 and 800? To make it easy, a big step. Why is it? Because it's a 2 megahertz laser, so it has much shorter treatment times. Then it has a centration aid that is called central line. Not for the experienced user, but I think for those who start with the VisuMax 800, this is important. Then a new tool that we all ask for a long time is the Oculine cyclotorsion control for the correction of astigmatism. And what easiness and facilitates our daily life is visualize, and that it's now connected to the refractive work plates. And a nice feature is also that it is independent from the patient bed. So those are our data. That's our way how we do the Smile Pro surgery. So we use very low energy, and the same is valid for the flap creation. So here you can see the central line centration aid. The vertex position can be entered in the treatment planning. The pupil center and the vertex position are indicated on the screen while approaching the eye. And the target mark guides the user to the correct location for best possible centration before docking. Here you can see an animation of this central line tool, and I think it's a good help, especially for beginners. Then the Oculine cyclotorsion adjustment is based on the IOMaster 700 iris image, and that's an animation how it works. I think one animation, when I saw it first, I couldn't believe it how fast. I thought this is really an animation. That's not real time, only 10 seconds for Smile Pro. It's not even enough time to talk to the patient. But of course, for the patient itself, it's a big step forward, because 10 or 5 seconds for flap creation in comparison to 30 seconds before is really better for the patient. Here we can see video, and that's also a nice tool. Every new VisuMax 800 has those cameras, which may facilitate the use for the beginning surgeon. We are doing now Smile for 10 years, and I don't think I ever looked at the videos, but if you're using the laser for the first time, I think it might be very helpful. Here you can see the patient looking at the green blinking light for the visual axis, and then the laser starts. What is also very important when you start with surgery, to tell the patient that the green blinking light disappears and that the vision is really worsening during surgery, so that the patient is surprised. Then the same with the flap creation is only 5 seconds, but as you have seen, a very nice bubble pattern. So we had a look at our first 154 eyes as part of our quality management documentation. We looked at the 3-month results, checking predictability, safety, and cumulative UDVA. We documented the complications, and we gave our patients a questionnaire and asked, would you recommend it to a friend? Would you do it anytime again? And did it increase your quality of life? We are doing Smile Pro from -1 to -10. Usually we try to have a cap thickness of 150 micrometers. As we all know, the superior part and the Bowman membrane are responsible for the stiffness of the cornea. So the further we go down, the more stable the eye is after surgery. And what we learned from the VisuMax 800, our personal nomogram needs a 10% addition. For example, if you correct -5 diopters, you have to target for plus 0.5 diopters. Here are the results concerning the safety. I think those are really excellent results. You don't have a loss of more than 1 line, and 8% even gained a line all over. And if you see what was a worst group, it was those with a minor myopia from -1 to 3. That's why in those cases we recommend our patients a femto LASIK. But to be honest, if a patient wants to have a smile, then the problem is he wants to have a smile. They often say, okay, if the correction surgery is a femto LASIK, that's fine, but first of all, we want to have a smile because it looks safer to us. We don't want to have a flap. That's where I quote Professor Secundo from the University of Marburg. He said the worst complication of smile is LASIK, so the circle procedure. And here are the predictability charts. As you can see, those are really excellent outcomes, as well as cumulative uncorrected distance, visual acuity, as well as the astigmatism correction. No patient had leftover astigmatism over 1 diopter. We had no intraoperative complications, and I think this is really remarkable. Of course, yes, we do have very long experience. We are not new users of the laser, but we didn't have a single vacuum loss because the time surgery is so short. We always had a wonderful bubble pattern. The lenticles could all completely be removed. There, on the other hand, in the last years, we have done thousands of smile surgical cases. I always wonder about videos where they couldn't be completely removed. We really could remove all lenticules, never had a problem with this. Not a problem means our lenticule, not black spots. Sometimes it's difficult. That's why I think it's not surgery for refractive beginners or surgical beginners. This is a real corneal surgery. This is not a LASIK, exclamation mark. All those patients had no intraoperative pain, so no intraoperative complications. And the questionnaire was stunning. All those 154 or 75 patients, they recommended it to friends. They would do it anytime again, and they said it really increased our quality of life. So, safety, predictability, and cumulative UDVI are comparable to VisuMax 500 data or LASIK data in the literature. However, from -1 to -3, we recommend our patients first to undergo a femtoLASIK because it's more precise. But as I said, some patients just don't want to have flap. Then we do smile surgery. The results are, as you have seen, very nice, but they're not as perfect in this group as with femtoLASIK. And if they're not as perfect, then patients still can do a circle procedure, so to say a femtoLASIK. We didn't have any intra or post-operative complications, and I think this is really outstanding for the first application of a laser. As this was one of the first 5 VisuMax 800s worldwide, that's really remarkable. One patient, there we had to do a circle procedure because there was a undercorrection of minus 0.5 sphere and minus 0.75 SIL. But at the end, the success rate was really 100%, according to our patient's perception. That's the outlook. What will we see in the next years? I hope integral nomogram will be first, then comes the correction of hyperopia, cyclotorsion control, and the correction of presbyopia. Thank you very much for your kind attention.